Hi, welcome to WCC6, our bone marrow transplant unit.
The purpose of this video is to give you tips and tricks to help make your transplant process go smoother.
These are the double doors to enter our unit. We ask that once you are admitted, you stay behind the double doors only for your safety. We have a special filtration system that helps prevent infection, keeps you safe. If you have to leave the unit for an exam or an x-ray, totally fine, totally safe. We just have you stay behind the door for the majority of the time just because of the filtration system. But you'll enter our unit, it's basically a big circle, and welcome to CC6.
And if you're looking for a change of scenery from your room, come check out our solarium here on the floor, overlooking the city of Rochester.
You can use any of our equipment in here, or you can take a few laps out in the hallway. 12 laps equals a mile. Patients who stay active tend to have a shorter hospital stay.
Hygiene is really important while you're inpatient to help prevent infection. There's a few things that you can do. Oral care is really important, so brushing your teeth every day. We have saline, which is basically salt water. It just helps prevent infection. You can use this as much as you want, and you can just rinse your mouth like a mouthwash. And then we also encourage showers daily. If you have a central line like a PICC line or a port or an IV, we will just cover that up, so just ask us. We'll get it wrapped up for you so it stays dry. And then you can take your shower. We also recommend CHG wipes. These are basically antibacterial wipes that you can use when your skin is dry after you shower. You can use these daily as well, and you just wash from the neck down. And these will also help prevent infections, keep your central lines clean, and keep you safe while you're here. While you're inpatient, we're also going to be recording what you eat and drink, and we're going to be collecting your output. There's a cord next to the toilet in case you need anything, you need assistance. You can pull that at any time. There's also one in the shower in case you need assistance. You can pull that at any time.
And this here is what one of your rooms may look like. In here, you have your own thermostat to temperature control. You've got a closet and a safe for storing your important stuff. Each and every day, staff will come in and write what's important on the board and write their names so you know who is taking care of you. We have your own fridge where you can bring items from home that sound good, yummy to you. And then over here, we have your bed. We will make sure that you get fresh linens every day. It's really important to prevent infection that you're getting a nice, clean bed. This here is our vital sign monitoring machine. We will do vital signs every 4 hours. That is at 8 a.m., noon, and 4, and then that will continue all the way through the night. And that's important just so we can make sure that you are doing well. Then, over here, you have your own personal bathroom, and this is for patients only. Family members are to use the bathrooms outside in the hall.
So we're going to talk about some of our daily routines while you're here with us in the hospital. We usually start each morning getting a daily weight. We also encourage you to perform your daily hygiene. We have the bathroom here in your own room for you to do that. The dietary technician will come around and order your meals for the next couple of meals for the day, but we also provide snacks on the unit if you need anything in between. We really encourage and promote you to be as mobile and active as you can while you're here on the unit. And we also recommend using the socks with the grips on them or your own shoes that have non-slip footwear, so that way we can prevent falls on the unit. You can ask your nurse about the visitation policy. Visitors are allowed usually from 8 a.m. to 8 p.m. Overnight, we will perform your lab work, so you can expect that to be done with your midnight or 4 a.m. vitals. And if your labs come back and you need a blood transfusion, we usually do those overnight as well. So you can expect to be woken up a little bit throughout the night and attached to your IV pull if you need blood transfusions or electrolytes. But we really do our best to group our care overnight and minimize sleep disruptions.
And this here is our unit-specific laundry room where a family member or a staff member can come and do your laundry. Detergent is provided. And this here is the visitor bathrooms out by our elevators off the